How can you tell if you have appendicitis? Well, appendicitis is one of the most common surgical issues that we see in the ER, and missing the signs of it could lead to perforation and sepsis. So I want to walk you through some of the signs and symptoms that we typically look for in the ER. So the first and obvious one is pain and tenderness to touch in this area over here, which is your right lower quadrant of your abdomen. If the pain began somewhere else, like in the area of your belly button, and migrated to the right lower quadrant at a later time, that's actually more concerning for appendicitis. Additionally, if the pain gets a lot worse with any kind of movement, for example, if you were to jump up and down and it causes the pain to spike way higher, that is also very concerning. So the pain of appendicitis is typically associated, but not always associated with a few other things. So a few other things that we typically look for are fever. So that would mean that you have a temperature that's documented with a thermometer above 38 degrees Celsius, a loss of appetite, or nausea or vomiting. So if you have any of these features, this is a very legitimate reason to come to the emergency department instead of going to a walk-in clinic or your family doctor. And once you go to the ER, if we do confirm the suspicion of appendicitis, typically what we'll do is we'll do some blood work, urine tests, we'll do a pregnancy test if you're a young woman, and then we'll send you for some sort of imaging like an ultrasound or a CT scan. If these tests confirm that you have acute appendicitis, the standard of care currently is to receive antibiotics and to go for laparoscopic surgery to remove your appendix.